What if your short luteal phase isn't just how your body works, but it's a fixable signal that your uterus isn't being given enough time for implantation or perhaps needs some additional progesterone support? Today, we'll unpack the real causes of short luteal phases, what to test and when, and the stepwise plan to lengthen and stabilize your luteal phase for improved health. I'm Dr. Monica Minjeur, the host of Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. Let's talk about a patient of mine who we'll call Bree. Now, Bree came to see us at about 30 years old, and she had been trying to conceive for the past 6 months. She noted that she was quite discouraged, though, because she did note an ovulation day with a positive LH surge, but her period kept showing up about 8 or 9 days later every month. She worried that something is wrong because after listening to our podcast, she knew that she should have a longer luteal phase in order to allow time for implantation to occur. After a couple more cycles with brown spotting before her period and noticing significant PMS, Bree decided to come and get some additional evaluation rather than continuing to just guess at which supplements would help her to get on the right track. When we looked at her charting, we revealed a clear peak or ovulation day. We saw that her luteal phase, so again, that time from when she ovulated until her next period started, was about 8 or 9 days every cycle, and she was charting at least 1 or 2 days of brown spotting before her period actually began. When we looked at other lifestyle things that were going on, Bree noted that she typically woke up fairly early because she worked as a teacher. She was oftentimes waking up at 5 a.m., but going to bed at 11 p.m., so getting only about 6 or 6.5 hours of sleep at most. Again, because of her work schedule, she was doing most of her exercise in the evening and enjoyed doing high-intensity interval training. We started off with some lab work to be done and found that her progesterone levels 7 days after ovulation were quite low at 9.2. Now, this is high enough to confirm that ovulation has occurred, but it's much lower than what is optimal for being able to have an adequate luteal phase and to be able to support early implantation and ongoing pregnancy. Her estrogen level at peak +7 or 7 days after ovulation was also low at 65. Her iron stores were a bit on the low side at 24, thyroid was normal, and a pelvic ultrasound was normal. So we started off, as always, with saying, what could we do to help restore or fix any of the underlying lifestyle changes? And so ideally, we always start with trying to fix sleep first. So worked on starting to improve the quality of her sleep, the length of time that she was sleeping, tried to get her to move her exercise to earlier in the day rather than that late night high intensity sessions, and started on some supplements to help replete her iron and make sure that she was on the correct prenatal vitamin. Most importantly, we started her on correctly timed progesterone after confirmed ovulation, which is what our bodies naturally should be doing anyways. Over the course of the next 3 cycles, Bree began to notice that her luteal phase was lengthening out, and she was now getting about 13 or 14 days from the time of ovulation until her next period started. She also noted that her premenstrual spotting completely went away, and she feels much more calm and hopeful that a pregnancy will come easier, knowing that her hormones are in a healthier range and she now has a normal luteal phase. So let's look at the big picture. What does a short luteal phase really mean? So what normally should happen in our body is that after ovulation, the corpus luteum that remains, or kind of that shell that's around the egg that was released, secretes progesterone. This progesterone spike changes the lining of the uterus into a more receptive and stable lining to allow implantation to occur if fertilization happens. If you don't have adequate progesterone levels or that luteal phase is too short, and typically we say consistently less than 10 days, your implantation chances may drop dramatically. Again, if fertilization occurs, but you don't have enough time to allow implantation to occur, that can be a problem. And also, if you don't have enough progesterone to help support that pregnancy prior to the placenta taking off, that can also create problems. As was the case with Bree, some of the common contributors we see can have to do with stress or sleep disturbances. So if you're not getting enough sleep at night, and again, we're aiming for at least 7 to 8 hours per night, that can create troubles. If you are on your screen late into the evening, that can create problems. And again, we typically are recommending no screen time at all, at least 1 to 2 hours prior to bedtime. If you are having problems with sleep, or you're not getting that adequate hours of sleep, or it's poor quality sleep because of late night screen time, that can change your body's ability to secrete gonadotropin-releasing hormone and luteinizing hormone, which are both responsible for improved ovulation and the quality of that ovulation. Other things that can cause a short luteal phase would be after an illness or after coming off of the pill. Now, the good news is most of the times those two situations are going to be temporary and reversible. So as we pass that illness, as we get to a point of where our hormones are better controlled and better stabilized, oftentimes that will improve that luteal phase. Additionally, if you have any problems with subclinical thyroid issues, iron deficiency, insulin resistance, all of these can lead to impaired ovulation quality. And really, I'd like to hone in just a little bit on insulin resistance, because this is an incredibly common thing that we see in our practice. We find that the progesterone levels are low. We find that you've got a short luteal phase or are suffering from infertility or recurrent miscarriages. And the underlying reason for why that's happening has to do with insulin resistance. A lot of this goes back to the theory that your body will work to stabilize your metabolism to help improve that insulin and blood sugar balance. And it's going to prioritize that before it's going to say that you're healthy enough and okay to have a good quality ovulation. So there's lots of ways that we can fix or improve what's going on from a progesterone standpoint, but really we want to trace it all the way back to what is the most underlying cause that's creating those issues and work to fix that. And then finally, one of the other common contributors we can see can be elevated prolactin or hyperprolactinemia. Now, I talked about this one recently in podcast episode number 136. So if you want to hear more about prolactin being elevated, go back and listen to that episode. But really the idea here is, again, elevated prolactin can impair ovulation from happening altogether, or in some cases, it can just lead to poor quality of ovulation. Now, it's really important that when we're doing the evaluation for these things, whether it's lifestyle changes, whether it's lab work, specifically if we're looking at progesterone and estrogen levels, timing is so incredibly important. So a single lab draw for progesterone that is untimed can be misleading. For example, your progesterone levels should be near zero prior to ovulation. So if you are somebody who ovulates a bit later in your cycle, just checking a random cycle day 21 lab draw may not be adequate. We need to check lab levels approximately 7 days after ovulation or after that peak day, because that's typically when your progesterone levels will be at its highest. Now, if timing is unclear, or if you don't have a certain set day of ovulation that you're able to pick out easily, sometimes we will check labs at a couple of different times during your luteal phase. But again, ideally, we're looking to see what is the highest point in which that progesterone gets in order to know what was the optimal range that the progesterone reached. We always want to look at that in conjunction with your charting. So again, figuring out the peak day, ideally by looking at either your mucus quality or a temperature spike or urinary LH hormone monitoring. Any of these can be helpful for picking out what is the exact day that you ovulated. From there, the day after ovulation counts as day 1, and then we count forward the number of days until your bleeding starts. That's how we discern your luteal phase. So if today is your ovulation day, the next day, tomorrow, would be day 1 of your luteal phase, going forward until that bleeding begins. And again, ideally, we're looking for a luteal phase of at least 11 or 12. In many cases, ideal is closer to 13 or 14 days. But definitely, if your luteal phase is less than 10 days, it does deserve additional evaluation. Another thing we're always looking for in your charting is where you might have other symptoms in relationship to that ovulation event. So if you consistently suffer from PMS symptoms or perimenstrual syndrome prior to your period starting, things like anxiety or sleep disturbances or irritability or carb cravings, Oftentimes, those will start in the week leading up to your period beginning and generally will resolve within a day or so of your period starting. This is a very, very common presentation that we see with low progesterone, and oftentimes we'll see that PMS symptoms go hand in hand with a shortened luteal phase. Other things we're looking for with your charting include any pre-period spotting or brown bleeding or irregular bleeding, and additional symptoms that you may notice. So illnesses, travel, high-intensity exercise around the time of ovulation, irritability. Again, all of these pieces go into place and taken into consideration when we are evaluating what's going on. Once we see that you've got charting under control and that you've got a clear day of ovulation, that's when we want to time those lab tests. So again, 7 days after ovulation is ideal. And for progesterone, if you are just looking for normal overall good health, we say anywhere between 15 to 17 nanograms per milliliter is appropriate for a healthy cycle. However, if you are trying to conceive, we find improved conception rates if your progesterone is somewhere in that 19 to 30 nanogram per milliliter range. When we look at estradiol, we want to correlate this with the growth of the follicle. And again, ideal is somewhere between 80 to 120 picograms per milliliter, or if you're trying to conceive, 110 to 250. So again, it really depends on what is your intention, and it doesn't always mean that you have to conceive in order to get optimal levels, but we can see significant improvement in other symptoms if your hormones are in a better range. We also would want to check prolactin. Again, going back to that episode from a couple of weeks ago, it's really important to check prolactin levels when you are fasting and ideally first thing in the morning. If levels are elevated, it's a good idea to recheck them again because that prolactin can play a huge role when it comes to ovulation quality, but also has lots of other things that can factor into a falsely elevated number. As we did with Bree, we also want to always make sure that we're checking your full thyroid panel, looking at iron stores and vitamin D, as well as assessing for any problems with insulin resistance, sex hormone binding globulin, or other symptoms that may be indicative of other hormone imbalances. We also oftentimes will evaluate or at least consider looking at a pelvic ultrasound and evaluation for chronic endometritis, especially if we have persistent brown bleeding at the end of your cycle or leading up to the period beginning. Now, most of the times, if you're only noticing some spotting that's starting before your cycle begins, we're going to assess for progesterone levels first and work on getting that corrected because if it is corrected, usually that's the underlying cause, is the hormone imbalance. However, if progesterone levels have improved and you are still noticing that spotting that's happening before your period starts, it is a good idea to get checked for other causes of that bleeding, whether it's chronic endometritis or a polyp or a fibroid or cervical inflammation or an infection, other reasons why you may be having that irregular bleeding. And as always, if you are trying to conceive, make sure that you're checking male factor early. At least if nothing else, start with a basic semen analysis because in about 30% of cases, there's both a female and a male factor. So we don't want to lose time if we have something else going on. We don't want to just assume that it's just a female component and be missing our window for being able to treat a male factor issue concurrently. So what do we do if you're found to have problems with your luteal phase? What does treatment look like? So again, always working to correct the underlying or longer term problems is a part of our treatment plan, focusing on those lifestyle changes. So again, as we did with Bree, focusing really strongly on improving that sleep quality. Ideally aiming for the same go to bed time and the same awake time within 30 minutes plus or minus every day can make a huge difference on your circadian rhythm. We also always want to focus on trying to avoid any caffeine after noontime and helping to avoid that blue light from the screens within 1 to 2 hours prior to bedtime. All of these things will help with improving your quality of sleep and improving the ability for you to get into that deep sleep faster, which helps with restoration of hormone balance as you are sleeping overnight. Now, in order to help fuel your follicle or get that stronger luteal phase, we want to make sure that your body is well supported to have an adequate ovulation. This oftentimes will start with making sure that you have appropriate amounts of protein with your breakfast. And for most women, we're wanting to aim somewhere between 25 to 30 grams of protein within 60 minutes of waking up in order to help support your luteinizing hormone and production of the appropriate steroids that your body needs in order to produce all of the other hormones. We also focus on daily omega-3s, getting adequate protein, fiber, balancing that with healthy carbohydrates like fruits and whole grains, and restoring your iron levels if iron is low. All of these things help to fuel your system to help your body to be in a good shape in order to say, yes, ovulation can and should occur this cycle. Of course, if there are other cofactors that are impacted from a hormone standpoint, we want to treat those to get them to a normal range. So if you've got abnormal thyroid health, or if your prolactin levels are significantly elevated for a long time, or if you're dealing with insulin resistance, we always want to focus on treating those underlying factors. And we oftentimes will say that's the chronic phase. That's the long-term goal, is correct those underlying factors that may be impairing ovulation in the first place. In the short term, and we can definitely use this longer if needed, we oftentimes will utilize progesterone given appropriately timed with your cycle. So as I mentioned previously, progesterone levels are incredibly low, always less than 3, up until the time that you ovulate. After ovulation has occurred, when that egg is released, the follicle that was around that egg turns into your corpus luteum, and that's what secretes additional progesterone production. So when we are giving you progesterone, we want to time it with when your body would naturally be producing it in the first place. And so typically in our practice, we're going to start progesterone 3 days after ovulation, and you'll continue taking it for 10 days. And we repeat this every cycle. Most importantly, we want to make sure that we are always checking your levels, again, 7 days after ovulation, to make sure that, first of all, the progesterone dosage is adequate, and also to make sure that it's not too much. In some cases, as we're correcting those underlying lifestyle changes, we don't continue to need as much of the progesterone support. If your levels are still low despite being on a high dose of progesterone, we oftentimes need to back things up further and give you additional medications to help with a mature follicle or growing the size of that follicle. So medications like letrozole or Clomid help to increase the size of the follicle that's developed, which leads to better ability to produce more hormones, specifically progesterone and estrogen, after ovulation has occurred. So some of the most common questions that we get when it comes to a luteal phase is, well, I've had a single cycle that I had a short luteal phase. It was about 10 days. Is that a problem? Again, we're looking at the big picture here, and patterns make all the difference. If it's consistently happening that your luteal phase is 10 days or less, we absolutely want to evaluate that further. If you have a single cycle that you've got a shortened luteal phase, it commonly can happen after stress or an illness or an infection. And usually we would say that's okay. But certainly if we start to see it on multiple consecutive cycles, especially if you are trying to conceive, or especially if you're having other symptoms of PMS or irregular bleeding, always, always, always worth it to have additional evaluation. So can I conceive if I have a short luteal phase that's only 9 or 10 days? Now, it's certainly possible, but your chances will improve by getting a longer luteal phase length and having adequate progesterone support. Again, it's not just about making sure that the number of days is correct, but when we look at the underlying why, if progesterone levels are not adequate enough, oftentimes that will significantly increase your risk for an early pregnancy loss or early implantation failure. Additionally, if you have not had enough time for implantation to occur, your body can actually start to have a period or start shedding that lining of the uterine wall before implantation sets up and is allowing HCG to spike to tell your body that it's pregnant. So making sure we have an appropriate number of days can really be beneficial in helping to not only allow fertilization to occur, but more importantly, implantation, in order to send that signal to your body to let that know that you are pregnant. Another question we get asked is, well, I've heard that this and such supplement can fix it. Now, certainly supplements have their place, but only when it's matched to an appropriate diagnosis. So for example, if your iron stores are low, then yes, adding an iron supplement or iron through your dietary sources can be helpful. If you're found to have insulin resistance, then yes, myo-inositol can be helpful. But a shortened luteal phase alone is not a blanket approach to just trying whatever random supplement is out there on social media. We also always are going to talk about the lifestyle changes that need to happen: appropriate sleep, improved protein and carb balance, and strength training as non-negotiable pieces for long-term improved health of your luteal phase. And will progesterone alone solve this problem? And this answer is a little bit tricky in that, yes, it can help to increase the progesterone. But again, this is a short-term solution. We don't want to have to rely on progesterone forever if we don't need to. And this is, again, why we always talk about utilizing progesterone for the short term, because it does tend to turn things around within 1 to 3 cycles. But we always want to be making sure that we are addressing the long-term and underlying causes for this issue of shortened luteal phases so that you can have long-term improvements in your overall health. Imagine if your luteal phase stopped arriving early and started holding steady because you matched testing to your cycle, supported ovulation quality, and gave your uterine wall lining the time and progesterone it needed. Over the course of a few months, spotting can fade, PMS symptoms can decrease, and your charts can feel reliable and predictable again. All of this can help to improve your overall health and promote fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in our Cedar Rapids, Iowa clinic, or can arrange for a telehealth visit if you live in many different states across the U.S. Check out our website for current states that we can serve medical clients, and let us know if your state is not listed to see if we can still cover you there, as we are constantly expanding our reach. Please note that our fertility educators are able to take care of clients no matter where they live. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.